have an impact, we have to think about the research. It goes from the bench to the bedside, and I think our behavioral and social scientists are actually closer to the bedside, and so we can have a more direct impact on the health of people, the prevention of drug abuse, and we can help translate those really fascinating basic science findings and to to impact the health of real people.
Intramural is dispersed amongst behavioral and social sciences research. Intramurally is dispersed among all of the various institutes and centers. So, for instance, there's obviously a large effort in neurosciences research, and a lot of that is more cognitive neuroscience or behavioral neuroscience oriented in nature. There's cardiovascular work that's being done, especially on cardiovascular risk factors and those types of things. There's work in behavioral genetics, looking at how genes and environment interplay and interconnect and interact. There's work in drug abuse and in monitoring of substance users and the context of their behavior and when and how it occurs. And I think that's an important component of what we want the intramural program to do, is to cover everything from some of the basic neuroscience work that needs to happen all the way up to more contextual sort of things where the environment and the community and the organization and the context of the behavior are particularly important.
Some of my experience as a behavioral and social science researcher at a primarily biomedical institution is that many of the investigators have considerable skepticism about the value of behavioral research. Sometimes that skepticism is a challenge. It's useful because it helps us see the strengths and weaknesses in our methods and results.
My research program began with the realization that in order for genomic translation to occur, we had to understand what were the barriers to the dissemination and disclosure of such information within families. So my research was the first to use social network methods to model the dissemination process in families who were receiving genetic services. And what I found was that kinship alone was not sufficient to describe that disclosure process. Rather, the qualitative aspects of social relationships were really important to that disclosure process. What we found is that relationships matter. Communication about genomic risk information, as well as receiving encouragement from family members, are important in motivating individuals to engage in risk-reducing behaviors, such as colonoscopy screening, for example, in families affected by Lynch syndrome. So we've used this information that we've gained through these studies to develop interventions, primarily in the context of family health history. And in those intervention studies, what we found is that introducing family risk due to family health history information into families actually activates pathways, communication processes, as well as encouragement processes that are associated with engagement and risk-reducing behaviors.
You know, I was famous for calling up people I did not know. I had read their work, and I thought that some of their expertise would help us in answering the question. I would call up, this is my name, this is what I want to do. I don't know anything about you personally, but I know your work. Can we talk about this issue? I think sometimes people get into their silos of expertise. It's I'm an expert in this, and it's not in my panoply of behavior to call somebody up and say, I don't know anything about what you do, but I think maybe it's important. Can you teach me?
As a cardiologist, I've taken care of many patients who are affected by lifestyle factors, particularly lack of access to physical activity, lack of access to healthy nutrition, and I have seen how that relates to the development of cardiovascular disease, particularly coronary artery disease. And so in my career, my objective has been to combine the treatment of cardiovascular disease with more of a population approach, and that's where the public health aspect came into play. So we're trying to address obesity as a health problem with our research and how particularly it relates to the development of cardiovascular disease. Obesity is highly prevalent, with over 30% of the U.S. population being obese, or with a body mass index at or above 30. But the populations that we target and that we focus on in Washington, D.C. are those where obesity prevalence is even higher than the U.S. average. The longer-term public health impact of our research is the potential to develop a program or an intervention that may reduce the prevalence of obesity, but also improve cardiovascular health for at-risk populations in underserved communities.
This drug use comes at a significant social and economic cost. It's estimated that $11 billion is spent on health care for substance use, and there's $193 billion in cost overall. So what we would like to do next in our research is to actually turn our electronic diaries into a treatment delivery system, provide just-in-time treatment. We know that substance abuse with the healthcare system can only be so long, but people remain at risk for relapse for very long periods of time. It would be great if people could just keep that clinician in their pocket, maybe could alert them to when they're going to be at risk for relapsing, and to provide them some information that could help them resist.
My lab investigates the molecular mechanisms that enable cancer cells to elude chemotherapy and continue to grow. I am keenly aware, however, that the cure to cancer in all its forms lies not simply in drugs that kill cancer cells. Rather, tackling cancer requires a better understanding of the environmental, behavioral, and socioeconomic conditions that not only contribute to the development of cancer, but hinder our ability to treat the cancer patient. This important investment can be further leveraged by engaging more traditional biomedical investigators in team approaches that involve behavioral and social scientists. The new Statman tenure track investigators recruitment process is one promising means for the NIH to attract highly talented early career scientists in fields that include behavioral and social science.
Even though my background is from a medical and pharmacological perspective, as I got more experience in the drug abuse field, it became really apparent that behavior is key to this disorder. And so we can't just study it from a medical perspective. We actually need to look at that behavior and look at the context of that behavior. And so we have to include all of that in our studies. In addition, when we think about substance abuse, the most commonly delivered treatment is actually a behavioral treatment. And so to deliver that treatment and have it be most effective, we need to understand the behaviors.